Hi, and welcome to my presentation. Today I'm going to explore a real-world application of the Newsvendor model that goes beyond simple inventory problems, and I'll be looking at how this powerful framework can be used as a model for a critical public health issue as given as the problem for this extra credit, the annual procurement of flu vaccines. So to set the stage, let's go back to 2009. Many of you might remember the H1N1 or the swine flu outbreak. Well, maybe not people our age, but our parents for sure. There was intense public fear fueled by media reports of a potential global pandemic, and a vaccine was crucial. But this created a massive dilemma for the US government. They had to decide how many doses to order from manufacturers, and the catch? This decision had to be made months before anyone knew how bad the flu season would actually be. So this placed them in a classic bind. If they ordered too many, millions of dollars in taxpayer money would be wasted on expired vaccines. But if they ordered too few, then citizens would be left unprotected, which could spread to widespread illness and even lead to death. So this is the core problem, making a single, very high-stakes decision in the face of very deep uncertainty. And so what's its connection to the Newsvendor problem that we've been learning in class? The problem of ordering flu vaccines is in fact very much like the Newsvendor problem. And let's break it down why this is such a reasonable model. Let's think about parallels as given in this table. The government acts as the news vendor, and the newspapers they're buying are individual doses of the flu vaccine, naturally. And then the uncertain daily demand is the total number of people who will seek vaccination over this entire flu season. The government placed a single large order or order quantity queue without knowing the exact demand, and this directly maps to the two critical costs that we studied in class: the cost of understocking, which we call the C_O, becomes the cost of ordering too many vaccines, and the cost of understocking, CU, becomes the cost of ordering too few, as given in this table. So what makes the demand of vaccines so uncertain? There are a few key main drivers. First of all, the severity of the virus itself. A mild flu season might mean that people don't feel as strong of a need to get vaccinated, but particularly nasty strain or the fear of one like the H1N1 can surge a massive surge in demand. Second is public perception in the media. A single news story about a child's death from the flu can drive thousands of people to the clinic, and this factor is incredibly hard to predict because it's all people's emotions in masses. And then there's also the perceived efficacy of the vaccine. If people just believe that the vaccine works well and is safe, then demand will be higher. And so in our model, we capture all this uncertainty by representing demand with a probability distribution. We can build this distribution using historical data from past flu seasons and expert forecasts from epidemiologists at the CDC, giving us a mathematical way to describe our uncertainty. What are the costs of modeling our problem in this way? The cost of ordering too many, our overage cost, is relatively straightforward. So it's the price that the government paid for each unused dose plus any storage, disposal fees. They're almost entirely financial and easy to calculate. But the cost of ordering too few, our underage cost, is where the problem becomes incredibly complex in my opinion and serious too. So some of this cost is monetary, things like lost economic productivity when people miss out on work, or direct cost of hospital stays, treatments for the sick. But the biggest and the most important component is really the non-monetary part, the societal cost. How do you put a dollar value on a preventable hospitalization or tragically a preventable death? The ethical cost is extremely difficult to quantify, but it's the single most important factor in the decision. And so the Newsvendor model forces us to confront this trade-off directly. This model also has additional complications because the real world is of course more complicated than a textbook model. The simple news vendor framework is a good starting point, but in reality, managing vaccine distribution has several additional challenges. First of all, the logistics. The model assumes your order just shows up. The reality is that a massive supply chain effort to distribute millions of doses across the country, all whilst keeping them in correct conditions, so refrigerated in, I think in a cold chain, that's what the word is. Second is equity. Unlike selling newspapers, you can't just give a scarce vaccine to whoever shows up first. Public health agencies must establish prioritization systems to ensure that the most vulnerable groups, like the healthcare workers, children, and the elderly, get the vaccine first. Then the problem isn't truly a single period. The flu season unfolds over months, and vaccine doses have a shelf life. This introduces the time dynamic element that a basic news vendor problem just doesn't capture. And so to conclude, whilst managing a national vaccination program has many complexities, the news vendor problem does serve as a powerful model and a highly effective model. It, I think, frames the core dilemma well, balancing the tangible financial costs of waste against the immense and often unquantifiable human costs of a shortage. And it also provides a structured, logical way for policymakers to make a better, more informed decision, even when faced with a lot of uncertainty. Thank you, and here are my references.